Hello, Nurse Jane. Are you ready to receive the handoff report to start your shift? So I am Elise. I've been taking care of Mr. Robert Jones in room 1. He is a 60-year-old male who is allergic to sulfa. He was admitted for difficulty breathing that has been resolved with controlling the fluid volume overload during my shift, and he has been diagnosed with chronic renal failure. Dr. Kindlebrook is his provider, but nephrologist Dr. Grossler has been added to his team, as well as home health nurse Jennifer. He is a full code blue. He has a history of chronic renal failure, type 2 diabetes, peripheral vascular disease, coronary artery disease, and atrial fibrillation. His vitals were taken at 0600 this morning. His blood pressure was 130/38. Heart rate was 100 and irregular. Respirations were 20. Temperature was 98.4 and his O2 stats were 90% on room air. He had a chest x-ray at 0530 indicating right upper lobe pneumonia 3 days ago. His blood glucose was taken at 0730 and was 72. His INOs are also recorded in his chart. There is a CBC from 3 days ago at 0430. It's in his chart that you can look at. The main things that you should know are his red blood cell is low at 2.7, hemoglobin is low at 9.3, and hematocrit is low at 28.2%. His blood chemistry was taken at 12:30 2 days ago to recheck his serum potassium level, which is finally within normal range at 4.8. And a day before that, his BUN was 52 and creatinine was 3.6. My assessments are he is alert and oriented ×4. His skin is warm, dry, and intact. He has a cardiac history of atrial fibrillation and ventricular tachycardia, which was controlled with amiodarone during my shift, but his heart rate has been consistently elevated with an irregular rhythm. He is on an ADA diet, so he needs to focus on low sodium, potassium, and proteins. His respiratory assessment found fine crackles related to the possible pneumonia and equal chest expansion, and he has a history of shortness of breath. As I said, his INOs are recorded in his chart, but you should know that he had 2 large bowel movements and low urine output that was a dark brown color at the end of my shift. His abdomen is soft and non-tender. He has a central line and an IV peripheral access in his left arm because he had phlebitis in his right arm. And he also has minimal urine output without furosemide, which is related to his kidney disease diagnosis. And he's very fatigued, not only from his diagnosis, but also we kept him up all night with tests. So my recommendations for your shift, you're going to need to administer gabapentin and glipizide later. There are also orders for PRN, acetaminophen, polyethylene glycol, and albuterol. However, I would recommend getting orders for oxygen therapy instead of administering albuterol because his heart rate has been consistently elevated and irregular, and the albuterol is only going to make that worse. The priority for your shift is getting him ready for discharge. I've been in contact with the home health nurse Jennifer. Her contact information will be in the chart. Mr. Jones' kidney disease has obviously not been managed very well, so I think you should find some time to collaborate with Dr. Grossler about dialysis treatment. Due to his peripheral vascular disease and diabetes, I think that you should focus your education on peritoneal dialysis and what that looks like for Mr. Jones. He also, as I said, had some phlebitis in his right IV site, so I put in a new IV in the left arm, and he will need to continue IV antibiotic therapy for pneumonia at home, so please don't forget to mention that when you talk to Nurse Jennifer. And he should probably have his serum electrolyte checked before discharge because of the 2 bowel movements he had during my shift. I'm not sure if Dr. Jones has anyone else at home, so I would talk about what peritoneal dialysis looks like for him, because a lot of times you need a partner or a home health nurse to help out with those nightly infusions or like the daily ones. Do you have any questions?